Hey guys, so this is Subu Medicine and welcome to Pharmacology. So from today we'll be making series of lectures that has to do with pharmacology. So what is pharmacology? Let's go with that first, right? So basically, let's write that term pharmacology, right? So whenever you guys hear pharmacology, right? Like look, this pharmaco basically referring as drugs and the logy means like study. So the study of drugs, that's going to affect or that's going to bring biological changes in our system. That is what pharmacology basically means, right? So in a simpler language, right? So we will just write down here, drugs, right? And then you're doing study of that drugs that affects our life processes. And how does that affect your life processes? We have to talk about that too, right? And before we talk about how does it affect our life processes, we have to talk about what are drugs. So drugs are any substance that has a chemical properties and that affects our life. Basically, that's what drugs are, right? Then we'll just write down any substance. But then what are the substances? So what are the sources of the substances? That we have to talk about, right? And whenever we think about drugs, we think about sources of drugs, right? It could be coming from plants, right? Like opium, for example, right? It could be coming from microbes, right? Like animal products, like hormones. It could be like animals products, like it could be like a pharmaceutical company, like for pharmaceutical preparations, like for example, like morphine sulfate, that could be one, right? So we'll just write down like pharmaceutical preparations, all right? So these are usually like sources of drugs, right? And all of the sources, they have the chemical properties, and what they do is that, that somehow that affects our life processes. That's what basically these drugs are, right? And then what do we have to talk about from here is that, before I go and talk about detail about the pharmacology, let's talk about basic. Whenever you guys hear drugs, right? Because we're talking about medicine here, so we need to know the nomenclatures of drugs as well. So what are the nomenclatures of drugs? Let me just quickly talk about that too, right? So let's just write down nomenclature. Nomenclature basically referring as, the naming of the drugs. And let's make this very clear too. And I'll take an examples of Tylenol. Let's just write down. And usually, you guys probably see this, something called okay, let's write down something different color. You guys probably hear something like generic name, right? Like a generic name. What does this mean? Generic name. And you also hear something like, like official name maybe, right? Official, generic name, or non-proprietary name. All right? What are these means? Like generic, official, non-proprietary. Sorry, cannot pronounce this correctly. But this basically means this means does not belong to anybody. That's why it's called non-proprietary. All right? And these are generic names or official name, which means that the government has actually named these drugs, all right? And there's another one, we call them a brand name, okay? Brand name. Or you said trade name. Brand name, trade name, all right? So, or proprietary name, meaning the proprietary basically, it belongs to someone, right? So brand, whenever you think about brand, what do you think? You think about like company that manufactured that. Right? So they give a special name for that drug as well. And then other one is a chemical name, right? So basically it's a chemical name. And we'll give an example too, all right? So now, basically if I take example like Tylenol, okay, we have to know whether it's a generic name or is it a trade name or is it a chemical name, all right? So basically when you hear Tylenol, that usually, the Enteral is actually a brand name because this company, whoever manufactured that, they gave that name called like Tylenol, all right? And then the generic, the government or official, the generic name is something called acetaminophen, right? Basically, they call this as acetaminophen. Acetaminophen, right? Basically, sorry, and usually, sometimes they refer as like R or something. So not R. Like basically because R would be a registered name here too, right? So basically acetaminophen, they have if you're from US, they might have the USP something like that, which basically means United States Pharmacopoeia or something like that. So you probably see that. And then brand name or trial number, you might see like R, like on top of that, which basically means it's a register name, right? So basically, because this company has manufactured the drug, that's why we call them a brand name or trade name, right? And then the chemical name is based on the chemical properties, based on the chemical structures. So if I draw quickly, like let's say Tylenol, I'll just quickly make a Tylenol here. So if I quickly make a Tylenol, it looks something like this. It has the benzene ring into it and the aromatic ring, right? And then if I just label this, and you have this bond right here, and you have an NH group, okay? And then you have the carbon number 4 hydroxyl group into it, and you have a ketone like this, and you have a methyl group, which is a CS3 like this. Which basically, the way it works is that you name this like 1, 2, 3, 4, 5, 6, right? Because it has in a carbon number 4, you have a 4, which is a 4, okay? And it's a hydroxyl group because it's a hydroxyl group, which is a hydroxyl, okay? And look, what is this? This is an acetamide group, and because it's amide, we write down N here. So N4 hydroxy, and this is a phenyl ring right here. This is a phenyl, PHE, right? NY phenyl and acetamide, because this structure is the acetamide, all right? Because it's NH group and also it's a methyl group there, right? So this is this is a chemical name of a Tylenol, which is the N4 hydroxyphenyl acetamide, right? And you don't have to know this, but I'm just telling you, right? So basically, I think it's important to know the generic and the brand name, because that's what often you see on if you look at the drugs bottle, right? If you look at the medication, that's what usually given them, all right? Now, after this, right, after the nomenclature of drugs, we have to come back here and talk about, this pharmacology. Whenever we study the pharmacology, here the pharmacology is, let's say broken down like into like subdivision in 2 categories, and that has to do with, let's write down here. That is called, let's write down here. The 2 categories, which is called, let's write down pharmacology, are divided into 2 subcategories, and one is called this is a pharmacokinetics, and other one is called pharmacodynamics. All right, so what is this pharmacokinetics and pharmacodynamics basically means? Look, whenever you hear the word kinetics, think about movement. So basically, pharmaco referring to drugs, and kinetics movement. So drugs movement, but where is it moving though? It's moving in our body, right? So that's why, think about this way. What is drugs, like, what your body is doing to the body, what body does to the drugs. That's what pharmacokinetics means. Whenever we're talking about pharmacodynamics, means dynamic, think about change or action, all right? So basically, what action, because why you're taking the drugs, so that way it can, remember, as we said, pharmacology, it affects our life processes. It brings sort of like biological changes in our tissue, right? So basically, what is the actions of the drugs in our body? Or what, you can simply say what, the drugs does to our body. Basic, that's what it means, right? And you need to be familiar with this term really well to understand this, all right? Now, after this, what we have to talk about here is that, look, the pharmacokinetics is what your body does to drugs, and this pharmacodynamic is what does your drugs do to our body, right? But we also have to talk about how do we get drugs in our system, though? How do you get it, right? So we have to talk about, in order for the body to do something with drug, or in order to have drugs to do something in our body, we need to somehow take the drugs, right? So we need to talk about before even we go here, we need to talk about the route of administrations, right? So the first key here is the route of administrations of this drugs. This is what we have to talk about, right? Now, there are different ways you can actually get drugs in our systems, right? And we have to talk about all of that, right? Because it's really important. And whenever we talk about the route of administrations, there are a couple of things that we need to think about it, right? The couple of concepts that we need to be familiar with. And what are those couple of concepts? All right, let's write down, let's make it here, right here. And we'll talk about this. What are those couple of concepts, that we have to know about? First is that we should always know about the chemical properties of the drug. What is the characteristic of the drugs? Is it a weak acid? Is it a basic? Because it works differently with the different parts of our organs, all right? So that's why it's really important to know the chemical structure or the characteristic of the drugs, okay? I'm not asking you to remember the chemical names of the drugs, but just knowing whether it's a weak acid, whether a weak base, whether it's a lipophilic drug, or it's a lipid soluble, fat solubles, right? These are important to know, all right? So we'll just write down here, let's say characteristics, or let's say properties of drugs, okay? That's one. You have to remember. And other thing is that we have to know is that what is the actions of the drugs, meaning the onset of the drugs. Like for example, if someone has a shock, you might want to give drugs quickly, and then so that way it can have a rapid actions. Or someone, let's say if I have a headache, then I don't need to have a rapid action, right? So we should always know about the onset of action too. There are a couple of concepts. Okay, and also what we should know about here is that, look, whether it is convenient for patient to use it, all right? Because for some people, it may not be, right? So it may not be convenient. Like for example, like infant would not able to take orally, right? So we also have to determine what is the easier method for them to actually take the medications, right? So we have to look for that too, their convenience. All right, so let's run a convenience. And the other one is that I don't know, but this is a big, to me, I think always look for the economical viable, the cost of the drugs, all right? The cost of drugs, whether the patients that you have, whether they would able to prescribe, or whether they would able to afford their medications or not, right? So we have to look at the economically whether they can afford the drugs also, right? So these are some of the characteristics I think we should know before we should prescribe any medications, right, to the patient. And after this, we will talk about, what are the roots of this medication that you're going to give, right? So first thing is first, always, oftentimes, you take drugs through where? It's more convenient, it's easy to take it, you through oral route, right? Through mouth, oral route. And actually, let's before we go there, usually these drugs, the way with the route of administrations, that actually divide into two parts. Let's write down here. So let's write down here. The route of the drugs, right? Route of the administration. Like drugs, let's write down here. They're usually divided into a couple of things. Usually main ones are your enteral. And basically when they talk about enteric system, they're referring as your gastrointestinal tract, alimentary canal, that's what we're talking about. And otherwise a parental, which basically means is that, parenteral, which basically means it's not going to go through the GI system, right? And then others, we'll talk about what this is. So usually the drugs, the route of administrations, right, they're categorized in enteral, parental, and others, right? And we'll talk about what those are means. So usually in enteral, some of the drugs, some of the things that takes place in enteral basically means because they are going through the alimentary canal, they get absorbed in alimentary canal. So that's why we have to talk about what are those root of those drugs, all right? So one of the things that get observed in your intestines is what? Oral drugs, for example, right? The oral, for example, we take it from mouth. So let's write down oral here, all right? So advantage of taking the oral drugs is, it's easier, it's economical viable, also, it's convenient too, right? So that's what it is. But then also it has some disadvantage too. The disadvantage is that, if you have a problem with the intestinal, for example, they are the one who passes something called first pass effect. And what is that called? Which is that whenever we take the oral medications, right, it gets absorbed in the intestines, and then there's enzymes there, right? And also then after what's going to happen here is that, okay, let's make it diagrammatically. I'll show it to you. Let's make this, okay, let's make it diagrammatically. All right, so usually this is esophagus right here, and intestine right here, right? So what is going to happen is that let's say you take these drugs orally. Let's say these are drugs right here. You take orally, go to esophagus, intestines, right? From here, what is going to happen? From like superior, inferior mesenteric veins, right? Gastric veins, all of them, they go to this, like this vein right here, which is called portal vein, right? And from portal vein, what is going to happen? Let's make it goes to this vein right here, and let's make this as this hepatic, this is a hepatic portal vein, it brings to the hepatocytes. And the hepatocytes here, they go something called metabolism, biotransformation, which basically means is that if the drug is like a lipid soluble, all right, it's a lipid soluble, then what is going to happen is that this liver has a lot of these enzymes, and then they'll convert that lipid soluble drugs, and it will make an inactive form. It will make a water soluble drugs, all right, and those water solubles are freely cleared out from your systems, all right. We'll go more detail about that when I talk about the pharmacokinetics, but I'm just giving you bigger pictures. And what is gonna happen is that, let's say I took 100 milligrams of a drug, and any substance, let's say 100 milligrams, so let's say I took a aspirin. It's gonna go, right? It's gonna go, and then what is gonna happen here is that, from the GI system, it'll go, and then some of the drugs will get metabolized in this liver. So let's say 70% of like drugs that get metabolized, or that get converted into water soluble drugs, meaning that they would not able to freely move around to the cells. They would be cleared out from your system through kidney, right? That means how much drug from there, the portal vein, the hepatic portal vein, to like what? It goes to the inferior vena cava. Let's make this an inferior vena cava, and from the heart, right? It goes to heart. And then if 70% of drug got process the metabolism, that means the 70% of drugs becomes inactive or become water soluble. And also like some of the drugs in this process in plasma, also what happens is they also bound to the plasma protein. You don't want to forget that too. So maybe only, let's say, 20 milligrams of this aspirin reach its systemic circulations, right? And that 20% is what is reaching at that means that what happens with the other rest of the drug, that drug went to a process called biotransformations, which means that they got metabolized by the liver enzymes and they become inactive, so we cannot use that drug, right? So that process, the fractions of drug that reaches its circulations after going this first pass metabolism, or we call them a first pass effect too, that is a first pass effect, because the liver is the main organ that metabolizes our drugs, right? I mean other areas like lungs, even the intestinal here, a kidney also does it, but the liver is the main target organ that do a metabolism process, right? So after that, what happens is only 20 milligrams of these drugs, let's say, reaches to your systemic circulation. That 20% is what we call them a bioavailability. All right, let's write down here. What is that called? The bioavailability. And we'll write down, and usually the bioavailability they refer as like letter F. Right, which basically means the ability means life of the drug, right? Bioavailability means life of the drug. The fractions of the drug that reaches the systemic circulations, that is what's called your bioavailability, all right? And sometimes they may ask you to like calculate this as well, all right? So, and we'll go more detail about this one too, but just letting you know, right? So the oral disadvantage is that, right? One of the disadvantages is that it has a what? It has like higher bioavailability basically, meaning that they have not higher, they have a lower bioavailability because they go to the first pass effect. All right, so because the fraction of the drug that gets to systemic circulations is very, very low, only maybe 20 milligrams are getting there. All right, now, and the other thing is that so orally it passes the first pass metabolism, and also onset of actions is slow. Like if you have headaches, right? It's we take either Tylenol or aspirins, and it takes time for that to work, right? So there's a delay or slow onset of actions whenever we take the oral drugs, right? So these are a couple of things that you should know about. Other thing is that there are other drugs like sublingually you take it, or buccal root. This is also part of the enteral. What happens? Sublingually means what? Lingual is referring as tongue. Sub means underneath the tongue. You put something. You put a drug. Like for instance, like whenever you have angina pectoris, right? Whenever there's the ischemic heart, because of the low oxygen, low blood is getting to the heart, right? It can give you angina pectoris. So in that case, what happens is like, they so often give this drug called nitroglycerin. And the nitroglycerin, what do? You put under the drug and it dissolves it. You don't swallow it, because if you swallow the drugs, it's not going to have that much effect. But if you dissolve it, what is going to happen here is that from the mouth, it will directly go to superior vena cava and it will go to the heart. That's what's going to happen, right? So sublingually, and it avoid what? It avoid the first pass effect, meaning that it didn't get to the liver. All right. So sublingual benefits of having a sublingual is like there's a quick, rapid response. Okay, and it is going to go to the heart much more quicker. All right. So that is what sublingually do. But disadvantage, if you swallow it, then it may not have any effect. All right. So rapid, quick, and also the bioavailability would be like a lot more higher comparing to the oral. It could be like 80 to 90%, not 100%, because some of them do get absorbed, right? So, in your tongues and stuff like that. So, do get metabolized, I mean. And then, so the bioavailability is basically, like, would be 80, 85, 90, that could, for the sublingual, or also the buccal root, because you guys remember this, there's like a buccinator muscle right? So, you put under the like cheek or the gum, right? And that's also called buccal root, right? Now, sublingual, buccal root, all right, same thing. And then other one we will talk about here is the rectal root, all right? Like down here. This is also part of the enteral, REC, rectal root. And here the rectal root, why do we give rectal? Maybe they're infants, like they can't take it, or they're vomiting, right? So they would not able to take it, or maybe unconscious patient, right? And usually you give them in the form of like something called suppository, right? They call it suppository. That's a dosage form, all right? Suppository. And then you just put it to the bottom, right? To the back. So, and the advantage of that is that, it is also like a, it's not convenient to put it underneath the bottom. But the importance here is that, these are important, because they do get absorbed and they do have a lower bioavailability, but still it's higher than oral one, all right? And other thing is that the rectal route is obviously it's not very convenient at all, right? And they do pass first. They do have this first pass effect with the suppository, also the rectal route, right? There are a couple of things that I do have to talk about. This oral route, right? Dosage form. Sometimes the drugs, the oral tablets, they come in something called enteric coated. Let's write down here the oral drug. Let's write the oral. They come in something called enteric coated, like drugs. Or what does that mean? Which basically means is, the drugs, tablets, what they have is that they have a lot of these polymer chains on top of the medications. And what that do is that is very, very insoluble in pH, like say insoluble in pH. What does that mean is that, like for example, let's say if you want to take like aspirin, let's use an aspirin, right? You know what aspirin does? If you want to take aspirins, but then what aspirin do is that, it can irritate the lining of the stomach. That's why aspirin can do, because aspirin is a weak acid. And when it goes to the stomach, what is going to happen is that it can become something called unionized, or get even more protonated, and it can easily cross the membrane, all right? And if that happens, that will have a much more effect or higher amount of effect on your stomach, all right? And I'll discuss more about like what ionized and unionized also, but right now I just want you to trust me and try to like get a bigger picture here. But as you go down in the small intestine, the pH of the small intestine is about like 6.7, 7.4, around that, all right? But the pH of the stomach is like 1.5 or 3 to like 3.5, right? So very, very acidic there, right? So enteric coated, what basically means is that because of that coated, they would not get absorbed into your gastrointestinal. They'll go and get absorbed more in small intestine. Okay, that's why we say it's enteric coated like drugs and medications, all right? And also there's other drugs which are also called extended time release, which basically the drugs, the way the drugs works is that they release it in a very, very slower set. So usually the oral drugs, when you take it, right, they're in different forms, right? Because they're in different forms. Like as I said, the regular tablets or sometimes enteral coated, which basically means that they're very, very insoluble insoluble down in stomach because of the enteric, the hard surface they have, all right, and that is made by those polymers. And then other thing is that the time extended release, which basically means that the way the drugs get releases in a very, very smaller amount of doses, releases in a very, very short period of time. And what is the benefits of that? The benefits of that is you probably know, sometimes, our elderly people, let's say they forgot to take their medications. They're supposed to take maybe 3 or 4 times a day, but because they keep forgetting to take the drugs, so you give extended time of release. In that case, what happens is that, the effect of the drugs stays, all right? So that is the advantage of the, extended time release drugs, all right? Now, so again, the enteral route, oral, sublingually, buccal route, and also the rectal route. We talked about this, right? Remember, the oral route has the higher, especially fat soluble drugs has a very, very low bioavailability because they go to a biotransformations which takes place is or liver, all right? And we'll talk more about what biotransformation too whenever we talk about the pharmacokinetics, all right? Now, after that we have to talk about what is this called? The parental. And usually whenever we talk about parental, all right, which avoid the first passive fact, it does not get metabolized in the liver, but it directly get absorbed in the plasma, all right? And those are usually IV, intravenous. Other one, we can say you have a subcutaneous and then intramuscular, all right? So these are the other ways to do it. So let's talk about it. So usually intravenous, you're giving through veins, all right? So whenever you give through veins, all right, what is going to happen? You put the veins, and from the veins directly it goes to the heart, and it directly gets absorbed into your plasma, okay? And it is a very, very, and the onset of action is rapid, very fast, because it directly through the veins, because look, all these things guys coming to the veins, right? Directly go to the veins, and then it directly goes to the veins and it gets absorbed in the plasma. So then after that, it gets redistributed into the tissues, right? So because of that, all right, it does not metabolize. It does not go to the process called this first passive fact. It does not get metabolized. All the 100% of drugs that get absorbed in your plasma, all right? So if that means nothing got metabolized, right? Which basically it has 100% bioavailability. Let's say graphically you look at this too. Whenever you look at this graph, right? And usually there's a plasma concentration on this y-axis, right? And then here, let's say the time here, right? And usually it looks like this. Whenever, let's say this is, let's say percent dose actually, let's say percent dose here, all right? And this time, whenever you give intravenously, right? What happens is basically, this is time, right? It rapidly goes up like this. It looks something like this, all right? Basically means that this is a 100% dose and comes down like that. That means that 100% of dose actually going to reach the system circulation. But if you look at the, let's say, oral route, usually from the time you take the drug, right? As you go, like this graph is going to go up like this. It's going to get absorbed, and then it's going to get redistributed, and after that it's going to start falling down like this. Right? This is process called elimination process, because after the biotransformation, what is going to happen is the drugs are, let's say, insoluble or inactive, and then those drugs get eliminated. So usually they refer this graph, and it's important to know this too, because this helps us to determine the bioavailability. Like for example, usually this referring as listen, this referring here this graph, right? We say the area under this curve, right? So basically bioavailability is equal to, for this one, if I want to compare, which is F, let's say, which is bioavailability, which is AUC, which is area under the curve, oral, how much you take, divided by, let's say, area under the curve intravenously. Okay? And usually, if the bioavailability is equal to is 1, that means it's referring as 100% of the drugs that reaches the plasma. But if, let's say, the bioavailability is less than 1, which means that the fraction of the drug that has been metabolized and became inactivated, all right, and also maybe some of the drugs bound to the plasma protein. The free drugs, okay, that is less than 100%. So in the oral case, let's say example, if, as we said, 100 milligrams of aspirin you took, but then 70 milligrams got metabolized, then only the 30 milligrams are active. You see what I mean? So that's what this bioavailability tells us, all right? And that's just an example, right? So this is like area under the curve, and this is for the oral route here, right? So you can say AUC for the oral here, and then this is AUC or the intravenous right here, okay? And this is how you can compare and contrast the bioavailability between these two. Again, bioavailability is very important, and we'll talk more about how the metabolism takes place also, all right? Now, after this, we have to talk about what is this intramuscular and subcutaneous. This is the parental way of giving these drugs, all right? So for that one, let's quickly make this certain things. Let's write down here. This is my skin right here, all right? And what kind of skin? This is called epidermis right here. And then let's say this is my dermis right here. And then below the dermis, what do you see? Below the dermis, you see a muscular right here. So you have an epidermis, right? The dermis. Then let's make this as a subcutaneous. Then you make up muscles right here. And then the last layer would be periosteal layer, all right? So you give the drugs, look, intramuscular right here. Okay, if I quickly make an injection, let's make an injection. The simple diagram for you guys, all right? All right, so basically we can make this as like injection. You give intramuscular, like for example, vaccinations. You get intramuscular, right? Like you put it right in deltoid muscles. So what is going to happen? What is the advantage of this? It does have a rapid actions, like onset of actions rapidly, but it's slower than intravenously, all right? Because intravenously is it is dangerous, because if you give more drugs, that's why it's really important to maintain the doses of the drugs if you're giving intravenously, because it directly gets absorbed in plasma. And from the plasma, what is going to happen? It is going to get redistributed to all of our body, right? So because of that, if you give too much, it can have toxicity, or it can have a lot of adverse effect. So it's really important to monitor the doses or amount of drugs when you're giving intravenously to the patient, because it directly gets absorbed into your plasma. So it is more dangerous, and also they're expensive, all right? This intramuscularly, what is going to happen? It is going to have rapid onset of actions, all right? But is it what? But it is what? It is slower than obviously intravenously, right? But it's really important that, sometimes when you give intramuscularly, what happens? The disadvantage is what? It can cause irritations, right? It can cause pain, it's very painful, all right? And other thing is that you can also give subcutaneously, meaning under the cutaneous, right? Like down here, look, muscular, and then you have the dermis and subcutaneous right here. So basically when you give subcutaneous right here, what is the importance of giving? Even it is a painful, all right? But this is also area, right? Like for example, subcutaneously, what are the drugs you give? Like insulin you give subcutaneously, all right? But then again, it is also painful, but also one more thing that is very, very important here. And they do avoid this first pass effect. Other thing is that, this is where, when you give subcutaneously, because around there's a lot of this mast cells are there, all right? And mast cells are what? They trigger allergic reaction, all right? So that's the reason why it's really important to have allergic test, all right? Because when you give subcutaneously, whenever you give any drugs, all right, that could cause an allergic reaction, because their masses are around there and they can produce what? Histamine, all right? So that is something that you have to be cautious about, all right? Now, so whenever we talk about parenteral, there's intravenously, subcutaneously, and then intramuscularly. We have to talk about those things, all right?